Mental health support teams, engagement findings for education settings. 4,599 people contributed to the engagement. This included 2,343 children and young people, 729 members of staff, and 764 parents and carers. Everyone involved in the engagement felt that mental health support in education settings is important or essential. Reasons for this is that education settings are safe and trusted places, that the mental health of staff and students is essential for them to thrive, and that lots of young people are suffering with mental health issues. The engagement findings found that for some education settings, there are strong communications with staff, families and services, dedication to promoting and improving mental health and emotional well-being, promotion and use of external services and agencies, and dedicated mental health and well-being staff in schools such as ELSAs and school nurses. When asked what's missing, teachers felt that there needed to be an increase in the number of qualified and trained professionals in schools. They also felt that more staff training was needed around mental health and emotional well-being, and more support for parents to support children. Children and young people felt that there needed to be an improvement in access and awareness of mental health support. They also felt that there needed to be more dedicated time and space to mental health and emotional well-being, and an increase in qualified trained professionals in schools. Parents and carers felt there needed to be an increase in the promotion, awareness and access to mental health support. An increase in the number of qualified, trained professionals in schools, and more support for parents and carers and teachers to support children and young people. To ensure the new mental health support team service works well for everyone, we asked staff, students and parents and carers to create the perfect mental health support team recipe. Staff members felt the recipe needed to include one-to-one and group sessions and support both in and out of school, a virtual offer to access support, mental health lessons around key topics, quick and easy access to the support that's available, workshops for staff and parents and carers to support children and young people, information, advice and guidance, fun and social elements to promote mental health and emotional well-being, and a strong communication and feedback loop with the service. Children and young people felt that the recipe needed to include one-to-one and group support in and out of school setting, a virtual offer to access support, mental health lessons around key topics, quick, easy and confidential access for children and families, workshops and resources for staff and parents to support children and young people, information, advice and guidance, and a fun and social element to promote mental health and well-being. Parents and carers felt that the recipe needed to include one-to-one support and group support both in and out of school, a virtual offer to access support, mental health lessons around key topics, quick, easy and confidential access for families and children and young people. Workshops for staff and parents and carers to better support children and young people. Information, advice and guidance. A fun social element to promote mental health and well-being. And a strong communication and feedback loop with the service. Finally, a huge thank you and well done to everyone who got involved in the engagement to make sure that the new mental health support team service meets the needs of our children and young people.